Question 20. 4 centimeter renal cell carcinoma tumor. Correct. Tumor thrombus in the renal vein extending into the inferior vena cava, but no local lymphadenopathy and no evidence of distal metastasis. Robson's staging of the tumor is stage 3A, the renal cell carcinoma, because it involves renal vein, so stage 3A. Involves renal, stage 3A. Involves renal vein and inferior vena cava, stage 3A. Stage 1 confined to kidneys, stage 2 to perinephric fat, stage 3B to local lymph node, and stage 3A to renal vein and inferior vena cava. Question 21. KUB shows calculus involving the lower polar and interpolar calyxes. Likeliest composition of the stone is magnesium and iron sulfate. We call it Steinhorn calculus. 22. Regarding prostate sarcoma in the adult patient, which is correct, it returns enhancement with cystic chain is typical. Prostate sarcoma in adult patient, there is heterogeneous chain enhancement with cystic chain is typical of prostate sarcoma. 20. What is the current method of choice for surveillance of the retroperitoneum? CLCT. The surveillance of retroperitoneum CLCT is the current method of choice. 24. Ultrasound bilateral multiple non-communicating well-defined cystic lesion in the peripelvic region, renal parenchyma, and the perineal spaces. Series is homogeneous. Amount to low T1 and high on T2 without enhancement. Needle biopsy to area of connective tissue with an epithelial margin. Finding most likely diagnosis multilog renal lymphangiectasia. Now look here, renal lymphangiectasia, because look there ultrasound bilateral multiple non-communicating well cystic lesions, and then there is no invasion of the surrounding structures, and CT scan it is homogeneous. Amount to low T1 and high on T2, so it is also cystic components. Needle biopsy shows area of concave connective tissue with an interstitial line with connective tissues, so diagnose renal lymphangiectasia. Question 25. Multiple stab wound to lower abdomen, blood pressure 80/40, so unstable. After fluid resuscitation, so patient is unstable. Ureteric injury is suspected. What would you recommend next? Single shot IVU. In unstable patient. In stable patient, CT KUB. Question 26. Transient cell carcinoma of the bladder, which is student staging investigation. At MRI, tumor is isointense 2 muscle on T1 and hyperintense on T2. Transient cell carcinoma is isointense on 2 muscle on T1 and hyperintense on T2. Question number 27. A number of special techniques are employed in mammography. It is not included. Low tube current is not used in mammography. Use of molybdenum A, the use of tungsten target, focal spot of 0.3 mm, and use of grit, you all seen in mammography, but not low tube current. 28. A 34-year-old woman presents with left lower abdominal pain, or responds to the complex adnexal lesion, which cannot be fully characterized. MRI shows 5 cm fluid structure with incomplete non-enhancing clique crossing it, with areas of focal narrowing and peripheral small low signal intensity nodule on T2. Amorphous shading of this lesion is also seen. The enhancement of the wall of the lesion of the gadolinium and administration is noted. Correct? Now ovarian tissue is seen stretched around the lesion, most likely diagnosed by self-pinks. Complex adnexal lesion which cannot be fully characterized. MRI shows 5 cm fluid structure with incomplete non-enhancing clique crossing it, and with areas narrowing and peripheral small low intensity nodules. This is self-pinks. Question 29. A 6-week pregnant lady, which is not correct. Lack of detectable cardiac activity in 8 mm CRL amplitude is normal. This is not correct, because there should be cardiac activity in 8 mm. At least 7 mm, there should be cardiac activity. So 30. Breast lump biopsy shows metastasis and areas of hemorrhage within it. Most likely primary tumor, melanoma. Most common metastasis, hemorrhagic breast metastasis is melanoma. Question 31. 4-year urinary adrenal calcification. This likely cause is adenocarcinoma carcinoma, because it occurs in old age, and this 4-year-old child urinary adrenal calcification, so least likely cause is adenocarcinoma carcinoma. Question 32. Which would not help differentiate a true adrenal lesion from a structural memory kit? Intravenous contrast medium to ensure a pancreatic mass is displaying the spleen vein anteriorly, because it should display the spleen vein posteriorly. So posteriorly it will be then it will be adrenal mass. We will not have differentiated true adrenal lesion from a structural membrane yet. Intravenous contrast medium to ensure a pancreatic mass is displaying the spleen vein anteriorly. This would not helpful. 33. Horseshoe kidney, which is incorrect. The incidence autopsy is 1:2000. Incorrect. Question 34. Taxation 99 mAg 3 nanogram, which is incorrect. The pure blood flow phase lasts for 2 minutes, 40 seconds. The incorrect because the pure blood flow phase lasts for 40 seconds, which is similar to arterial phase, about half minute or 1 minute. It's not 2 minutes. 35. Solitary learning in breastfeed is benign process, large calcification. Microcalcification are malignant, but large calcification are benign. 36. Anatomy of the breastfeed is true. Increased enhancement of normal breast parenchyma during lactation is seen in MRI. This is normal, true. Rest all are false. Question 37. Suspected pelvic malignancy, MRI with DWI shows slight T2 hyperintensity, high signal and high B value and decreased signal ADC, most likely diagnosis. High cellularity tumor because high on DWI, bright on DWI. Pelvic malignancy, MRI with DWI shows T2 hyperintensity, a high signal on high B value. So DWI is high, so high cellularity tumor. Question 38. 2 cm adrenal lesion, intensity of 18 HU before contrast medium, 58 HU in the portal lens phase, and 57 HU at 10 minutes, most likely diagnosed metastasis. Because it's showing washout. Before contrast 18, then 68 HU in the portal lens phase, and the late phase it is washout showing. So most likely diagnosed metastasis. Greater than 15 HU, correct, and then it shows washout 57. 39. Mammography shows unilateral diffuse increased density of the right breast with skin thickening, coarse reticular pattern with prominent Cooper ligament and no microcalcification, whereas is likely granular cell tumor. Because all these features is likely seen in granular cell tumor. These all skin thickening and coarse reticular pattern. This shows maybe radiotherapy, change, reply, obstruction, inflammatory carcinoma, recent surgery, but not granular cell tumor. 40. Anatomy of the retroperitoneum, which is true. The right perineal space communicates with the gray area of the liver. This is true. Right perineal space communicates with the gray area of the liver. 41. Asymptomatic 1.5 cm unilateral calcified extrarenal solitary renal artery aneurysm. Where incorrect, the lesion should be treated surgically. Because it is less than 1.5 cm, it is small, so it should not be done surgery. It is resolved spontaneously. 42. Neonate with abdominal wall defect and bilateral hypoparathyroidism, which will not support a syndromic diagnosis, trapezoidal low capacity bladder. But this is prone belly syndrome, so in that there will be trapezoidal low capacity bladder also. 43. History of ataxia series with multiple solid lesions within the right kidney and absent left kidney with solid dip nearby and multiple early-pancreatic lesions within the pancreas, most likely diagnosed by Happel-Lindau syndrome. All this history of ataxia, that's hemangioblastoma, then solid lesion within the right kidney, absent right kidney, because the left kidney is removed due to renal cell carcinoma, and then cystic lesion within the pancreas. So all these one Happel-Lindau syndrome. 44. Breast lump, which on ultrasound suggests a malignant rather than benign cause, is taller than wider. Malignancy on ultrasound in breast lump is suggested by taller than wider in Barrett's criteria. Question number 45. CT shows large perinephric hematoma, which is least likely cause polycystic dysplastic kidney. Perinephric hematoma, least likely cause polycystic dysplastic kidney. Rest all may be a cause. That is, renal cell carcinoma, autosomal dominant polycystic polyarteritis nodoso angiomyolipoma may cause perinephric hematoma, but not polycystic dysplastic kidney. Question 46. CT shows heterogeneous enhancing mass which does not extend across the midline, displays the major vessel, which contains not associated proptosis. Because the diagnosis is Wilms tumor. Enhancing mass which does not extend across the midline, displays the major vessel. The Wilms tumor is associated with Beckman-Weidman syndrome. Beckman-Weidman syndrome shows all of these features, but does not show proptosis. Question 47. IV to the bilateral straight nephrograms, where is least likely amyloidosis. Bilateral straight nephogram is not seen in amyloidosis, it's seen in all of these. It shows hypertension, pulmonary and non-functioning kidney, but does not show amyloidosis. Question 48. 50-year-old man after acute diabetes, a swollen, foul-smelling, red, tender slaughter with presbyrocapitis, which is true. These all show 4-year gangrene. So what is show? CT is the best test to investigate the extent of spread. Diagnosis for gangrene, and for it we do CT scan to see extent of spread. 49. Renal lesion, CT shows 2 cm round homogeneous, well defined without calcification and situated in the upper pole of the right kidney. It is 60 Hawkins unit after the material contrast and increased 69 HU, likely is diagnosed simple cyst because it shows less than 10 HU increase, so it is non-enhancing and it is simple renal cyst. First to 60 HU after contrast is 69 HU, so less than 10 HU increase, so simple cyst. Question number 50. Ultrasound shows partly soiled / partly cystic midline mass, which would not support diagnosis of organ torsion. Enhancement of a solid compound on CT. If it is enhancement, then it means that is vascularity, so it's not torsion.